Let's talk about the 10 signs of a dying liver, and I'm talking about end-stage liver disease. Now, the liver is very, very rugged. It can regenerate, but there's a point of limitation where you get to the stage where it's almost impossible to reverse. However, if I had end-stage liver disease, I would do everything I could to try to reverse it. Now, before I go into the end-stage signs, let's talk about the first two symptoms that usually occur when you start having liver problems. Number 1, it's malaise, which is a difficult symptom to describe because it's the absence of wellness. You just don't feel quite right. And then you have fatigue. Okay, so those are the two first symptoms. But as things progress over the years, you can get these indicators. Number 1, confusion or disorientation. Okay, that occurs because you have ammonia that is building up in the body and it's going up into the brain. This is because the liver is responsible for detoxifying ammonia. Number 2, ascites. Ascites is an advanced liver disease where you have a protein, albumin, that is backing up in the blood and you're getting this fluid leakage into a sac around your belly. So it looks like you're pregnant. I mean, the best description is the guy on the beach with the Speedo and the pot belly. That's ascites. You can't see any fat on the person except in their belly because it's not really fat. It's a fluid-filled sac right in the stomach. And many people go to the hospital and they get it drained, and then a week later it comes right back because they didn't fix the liver. So ascites is a sign of advanced liver disease. Number 3, severe itching, okay? It's called pruritus. This usually occurs because you have a problem with your bile salts, alright? Because the liver makes and controls the production of bile salts, it kind of backs up into the system and even the skin, and it can affect the sensory nerves. You start turning yellow, the whites of the eyes turn yellow, the skin turns yellow. That's called jaundice, alright? Your appetite goes away. Personally, I think this is kind of a survival mechanism where you lose your appetite so you can start fasting. I mean, that's just a theory, I don't know if it's true, but when you fast, all sorts of healing occurs, including something called autophagy, which is the recycling of old damaged protein. And with advanced liver disease, you have a lot of fibrosis going on. So, no appetite is a symptom. You feel weak, you feel fatigued. Number 4. 7, you feel nauseated. Number 8. You're gonna get bloating, especially every time you eat. Then we come to 9. Edema in your ankles and your legs, especially on the left side because that's where your liver is. You'll get it on both sides, but mainly on your left. And lastly, you'll get a lot of bruising going on because the liver is intimately involved with vitamin K, and there's a lot of other symptoms with liver disease. But these are the top 10 signs of an advanced liver disease situation.